Good evening. My name is Husham Al-Shather. I'm one of the consultant specialist doctor in pain medicine. I work in Royal Berkshire Hospital, and I've been invited by the patient group in Townlands Hospital to give a talk about our pain department. So thank you very much for the invitation. My talk mainly about our service that we provide in our pain department. I'm more than happy to answer any question after the talk. Thank you very much. So today, my talk going to be about our pain department mainly, what service we provide, and hopefully you'll get some more information about that. I'm more than happy to answer any question at the end of the talk. So basically we are a multidisciplinary team. So we are doctors, we are 4 consultants, we have trainee as well, sometimes they come with us. We have 4 specialized nurses, we have 1 specialized physiotherapist in pain, and we have psychologists as well that deal with pain mainly. So we provide comprehensive pain management. So our aim is like we work as a multidisciplinary team. You not come to see the doctor only or the nurse only or the physiotherapist. It's like a package we provide the patient with when they come to the pain department, either acute or chronic. So we provide the hospital with acute pain service as well, which is this is unique because most of the other hospitals usually provided by anesthetic department, which they don't have much experience in pain as people who does anesthetic and mainly pain. Chronic pain, we do chronic pain clinics as well, which mainly see the people who with chronic pain. This means the pain more than 3 months, or we call it persistence pain, and there are different kind of chronic pain. The acute pain is the pain that should disappear after the tissue healing. For example, if somebody has a burn or a surgery and the tissue healing should be expected within 2 weeks, so this pain should be disappeared. But there's a time limit as well. If it's less than 3 months, it's acute pain. More than 3 months, it's chronic pain. We talked about this, so we offer basically advice. So the advice can come from patient, so the question can come from patient or GPs or other consultant. We provide evidence pain treatment to the patient and support, and we provide specialized physiotherapy and psychology support. So mainly for pain, either one-to-one or group therapy. And Renato, my colleague, will talk about this more details. So what we treat, basically, in terms of chronic pain, we see a lot of variety of patients. I would say the majority of our patients, usually back pain, either upper, lower back pain or mid-thoracic or other kinds of back pain. We also treat neuropathic pain, so the pain that comes from the nerve itself. Chronic regional pain syndrome, which is a very specific neuropathic pain, is very painful. We specialize in this as well. And we see other kind of pain like after surgery, phantom pain, abdominal pain, pelvic pain, headaches, facial pain, post-shingle pain, so we call it post-herpetic neuralgia. And also we see a large population of fibromyalgia as well. And my colleague, which is coming afterward, Deepak, he will talk about fibromyalgia today in more details. So we do medication review. So usually the patient, when they came to us, we have enough time to see them. Usually GPs have only 10 minutes to see you, so they don't have much information to take in 10 minutes. For us, we have like at least half an hour time to see the patient. So we take a detailed history, a good examination, and if they need any investigation, we provide them. And we work out like a differential diagnosis, what's the most likely cause of their pain. And then we do the medication review, we provide them with advice, maybe strong painkillers as well if they need, specialized painkillers like anti-neuropathic medication. We provide acupuncture service as well. Unfortunately, it's not approved for back pain anymore, but we do it for other kind of chronic pain. We do transcutaneous electrical nerve stimulation TENS, so we do it in acute and chronic pain. We give advice of this. Many patients or people don't know about it, but it has some good effect on patient with pain. And we are one of the rare departments that we provide ultrasound guided pain procedures. We specialize, for me, myself, I trained in using ultrasound. So not all our procedure needs X-ray. So we can do it as like an outpatient procedure. Patient, they don't need to come and be starved, wait all the day to have a daycare surgery and the X-ray. We can do it under ultrasound, and we and patient avoid the exposure to the X-ray as well. It has many advantages as well. We do trigger point injection clinics, which is like a quick injections for the patient, so that again they don't need to wait the whole day for this, and the waiting time for this is much less. We provide a lot of intervention. So in addition to acute pain, chronic pain clinics, advise, we do a lot of procedures. We do, for example, epidurals, like not only for acute pain relief, for chronic pain, we inject steroid or certain kind of drugs that release the adhesions, for example. We can do different kind of epidural, like thoracic, cervical, caudal. We do nerve root blocks for nerve root pain. And we do radiofrequency treatment, which is basically applying a radiofrequency current that produce heat, and this will stun the nerve or burn the nerves, and this will give very good pain relief. So we can do radiofrequency for shoulder pain, for hip pain, for knee pain, for ankle pain, and we can do it for peripheral nerves as well. And we do the other kind of injection, maybe you heard about, like sacroiliac joint, facet joint injection. Basically, we provide most of the procedures in chronic pain, except the procedure that usually provide in tertiary centers, for example, spinal cord stimulator, which needs a big budget and bigger department. But otherwise, we are advanced in providing many procedures. One of our doctors, she's specifically specialized in pelvic pain as well, so mainly for men and women, but she does work part-time in London and here, so she does some pelvic pain. My colleague Deepak specialized, for example, in fibromyalgia and widespread pain. For me, I'm specialized in neuropathic pain and complex regional pain syndrome and ultrasound guided. So we have a varieties. We do clinics in Royal Barks mainly, we do in West Bark, and we do here as well once a day by my colleague Dr. Ramos. I think this is important to know. The reason I put it here, I usually give it to GPs, like these are important things, but for you, as a patient, like if you develop this or one of your family develop these symptoms, so you need to know about the red flags. This means you need to act urgently. You need to contact your GP and see the emergency department, for example, before come to us. So this is very important. So if you develop acute severe pain after major trauma, this is a red flag. Or minor trauma in elderly. Okay, so because they have like sometimes people have osteoporosis, so weak bone, so the bone will fracture easily. This is a red flag. If there is a possible tumor or infection, so if this acute severe pain develop in people very young, below 20 or above 50, so between 20 and 50, usually not, well, it might be a red flag, but below 20, above 50, it might be more red flag, especially if acute severe pain with people who have cancer, or they have weight loss, or if there is like fever, chills, weight loss, this is mainly infection, or the people who use IV drug users, immune suppression, so they are on chemotherapy, or basically if the pain worsening at night, if your pain become really severe at night, this is again a red flag. So you need to contact your GP urgently or the emergency department. If you have abnormal neurology, this is very important, like you cannot control your bowel or bladder function, or you have like you cannot move the part of your body with the pain, this is red flag. So you need to contact us urgently, please. You need to act quickly on that. The other thing we see urgently as well, like people with severe back pain and sciatica that not responding to adequate analgesia. For example, if you have severe back pain with sciatica and you went to the GP, he gave you some medication, or they gave you some medication, and you're still in severe pain after 2 weeks, 3 weeks, you need to act on that. So you don't need to wait for the GP to call you back. You need to go and contact them. Tell them, please refer me urgently. That's what I should be seen quickly. So it's very important. So this means if your pain is not improved, most of the time the pain will improve. Or severe neuropathic pain like burning sensation, pins and needles, and if you have it or become really worse recently, we need to see you urgently. We're happy to see you urgently. We have slots for urgent cases, but very limited. And complex regional pain syndrome, where the part of the body that have severe pain becomes swollen, red and hot, change temperature, sweating, you cannot move it, this is urgent as well. Okay, so hopefully this is clear. This is just like, it's mainly for doctors, but it's nice for yourself to understand about red flags. Other referrals which we see, like if you, for example, have chronic pain and your medication, the dose increasing and not helping, GP usually good in that, but if they cannot help, we are more than happy to see you. If you take a lot of medication, like for example, specifically opioid, and you want a review, we're more than happy to do a review for the medication for you, maybe start you on things or decrease the dose or the frequency. We have a few achievements, so that's why I want to let you know about the department. So we are the only place in the region where we do lidocaine infusion and the Quatenza. So Quatenza, it's kind of patch that contains chili, capsaicin, and high concentration, and usually used for neuropathic pain. IV lidocaine infusion, which works really well for people with widespread pain, fibromyalgia, and neuropathic pain. So we have specific slots for those patients and procedure list. We are the only hospital in the area with the one non-medical prescriber, which is Renata. We're going to talk about this. We are one of the hospitals that develop a very good pain management program, which is Explore. So you don't see pain management program in many hospitals. We have very good integrated system with the community. So we usually never left alone when the decision happened in the community. We've been asked many times by Swindon, East Berks, and Oxford for help. Our waiting time is not short, but within acceptable level, and usually see patient on time. So we have pain management app as well, so which you can all download. It's called Microguide. We can give more information about this, which you have a lot of information about drugs and service we provide. Our nurses do inpatient and outpatient pain, so this is not usually common. I think we are the only hospital we do this here. We do a lot of intervention, ultrasound guided fluoroscope. We do opioid reduction clinics, so people with high dose of opioid, we're happy to decrease the dose. And we work in the community, the IPAS, integrated pain and spinal service. But I don't know if we cover this area, but for the Royal Box, we definitely cover this area. And that's it, basically. We've been rated as outstanding by recent CQC team, where they visited our pain department, and we always have, well, not always, most of the time, we have very good feedback from our team. And that's it. Thank you very much.